Alright, so this video is for those of you who are thinking about a potential career in medicine. In North America, medical school is not direct entry after high school, which means that medical students will come in usually with a university degree. Some of them may also have masters, PhDs, or even whole careers before medicine. After medical school, in order to practice independently, almost always you have to do a residency, a period of time, kind of as an apprenticeship in your area of specialization. For those hoping to pursue a subspecialty, there's another training process called fellowship. And then finally, once you finish that, you can practice on your own as a physician. So looking at medical school, usually again in North America, this is 4 years. There are some 3-year schools which are a bit more intense. And medical school is divided into two phases. The pre-clerkship phase, which is usually classroom-based, focusing more on the science of medicine. And you have clerkship, which is your experiential, practical learning component. The culmination, if you will, of medical school is a match process where medical students are matched through an algorithm, and there's a couple different ones in North America, to a residency spot. There's a lot that goes into a match. The match, there's a lot of strategies that people will use, but ultimately, most medical students will end up with a residency position, one location, one discipline. And as I mentioned, they'll spend 2 to 5 years in this field, studying, learning on the job training. So for example, this might be a surgical discipline, might be internal medicine, might be pediatrics, obstetrics and gynecology, family medicine, perhaps some of the more common ones. If you're interested in a subspecialty, for example, like me, I'm an oncologist. So I did my 3 years of internal medicine, and then that was followed by 3 years training in medical oncology specifically. That's termed a fellowship. For some fellowships, there's another match process. For others, you just apply like a regular job. But at the end of all that training, that's when you get to practice as an independent physician. Now, there's a lot of literature, a lot of chatter out there about what it takes to be a successful physician. Some of the things that are commonly looked for when interviewing or when looking at applications is evidence of communication skills. Certainly, communication skills you'll work on during medical training. You'll get a lot of training in it, but they're looking for some level of baseline that you're going to come in with. Compassion and empathy are a must. Medicine is a caregiving profession, and people who are looking for medical school candidates or medical students, they're looking to see that that's something that you have, right? That you have the ability or that you do care about others. Along those lines, a moral code, right? When we speak about caring for others, we want people with a sense of right and wrong. That's hopefully aligned with the medical profession and healthcare in general. For medicine, you want people who are hardworking, or I should rather say that you need to be hardworking to get through medicine and to get through medical training. It's very intense, very arduous, and kind of the process, as I laid out, it lasts a while, right? And along those lines, resiliency is a must as well, and having tools and ways to focus on your well-being and, balance out the different areas of your life. And just to give you a bit of a snapshot, especially in that pre-clerkship phase of medical school, some of the things that you might be learning about are basic sciences, anatomy, physiology, and pathology. So kind of how the human body is supposed to work and all the ways and all the things that go wrong. Pharmacology, so drugs and medications that we give. Communication, ethics, remember I talked about that moral code being really important. Microbiology, genetics, and then specialty specific things. And I realized I spelled that wrong. Things, related specifically to internal medicine, to pediatrics, obstetrics, to surgery. And there's a lot of individualized learning in the different disciplines as well. So that, in a nutshell, is or are some things that you should keep in mind if you're considering a career in the medical field.